This week's Social Security Insider's report will discuss the Trump administration's plan to dismantle the Medicaid safety net. As a former medical professional, I find Trump's attempt to dismantle Medicaid a particularly despicable act. Medicaid is a joint federal and state government health insurance program. It is designed to provide free or low-cost health coverage to low-income individuals and families. The United States is one of the best medical systems in the world if you can afford it. Many Americans fail to understand that without affordable accessibility, it doesn't matter how good the system may be. I recall the reason why I left the medical field. My exit was primarily motivated by a system of managed care. With managed care, insurance companies, rather than a physician's opinion, determine who would receive needed care. Insurance companies are corporations whose primary focus is profit, not patient care. With profit as the primary goal, treatment minimalization is inevitable. Worse yet, those who make treatment decisions within the companies are financially rewarded for denying needed treatment. This approach not only reduces the quality of care but often results in unnecessary deaths. This greed-driven approach to medical treatment is now the norm. The only way to circumvent these access restrictions is to pay out of pocket for the treatment required for the best outcome. These additional fees, in the form of deductibles, etc., leave people with limited incomes without adequate care. So, what happens if Medicaid is dismantled or privatized? Before we answer this critical question, here is a word from our sponsor.
Did you know the Social Security Administration offers a professional home-based gig opportunity that pays up to $7,500 per case? This opportunity costs nothing to access, offers national certification, and has no significant barriers to entry. Sound intriguing? Visit www.ssahelp.com. That's www.ssahelp.com. Act now.
If Medicaid were to be severely restricted or dismantled, the consequences for millions of Americans would be devastating. The most vulnerable populations, including low-income families, children, pregnant women, the elderly, and people with disabilities, would face dire health outcomes and financial ruin. Impact of Medicaid restrictions. Loss of coverage. Approximately 93.8 million people who relied on Medicaid in fiscal year 2022 would lose their health insurance. This would leave a significant portion of the population without access to essential medical care, preventive services, and life-saving treatments. Is this the medical outcome you would expect from a nation that cynically considers itself the world's greatest nation? Increased mortality. Studies have shown that Medicaid expansion has saved lives. Restricting or dismantling the program would likely lead to increased death rates. This increased death rate would be particularly true among low-income adults aged 55 to 64, in states that refuse to expand Medicaid. Economic devastation. Families would face catastrophic medical bills, leading to increased bankruptcies, homelessness, and poverty. Sadly, these financial burdens existed before Trump and the Republican Party decided to make things worse. Medicaid currently provides coverage for about half of all United States births, and its dismantling would leave many new mothers and infants without crucial care. The strain on the healthcare system. Hospitals, especially in rural areas, would face closure due to increased uncompensated care costs. This would further reduce access to healthcare for entire communities. Statistics on Medicaid's impact. Medicaid covers approximately 48% of all children in the United States as of 2025. The program pays for half of all United States births. Medicaid spent $295 billion on long-term care services in 2023, covering about 6 million Americans. My professional prediction: if Medicaid is dismantled. The dismantling of Medicaid would exacerbate existing health disparities, particularly in southern states that have already restricted access. We can expect to see a widening gap in health outcomes between the wealthy and the poor, effectively creating a two-tiered healthcare system where quality care is only available to those who can afford it. In conclusion, the attempt to dismantle Medicaid is not just a political move, it's an attack on the health and well-being of tens of millions of Americans. If successful, it will undo decades of progress in public health and social welfare, leaving a legacy of suffering and inequality that will drag down this nation's economy for decades to come. In our next Social Security Insider Report, we will introduce you to an invisible crisis so insidious that it could destroy your ability to ever retire. If any two of these 5 events occur, current retirees can also kiss their retirement goodbye. Social Security is under siege. Protect your Social Security benefits by becoming an Entitlement Protection Network (EPN) member. EPN is your trusted online resource for safeguarding Social Security benefits. Timely information and analysis are critical to financial survival. This is especially true if you depend on or have a family member who receives Social Security benefits. EPN membership is your dedicated source of vital information designed to protect your access to SSA benefits during these unstable times. EPN lets you stay informed about potential changes to all Social Security programs. Access expert analysis of policy proposals. Techniques to protect you from arbitrary removal from SSA benefits. We'll even guide you to the proper professional assistance if needed. Don't wait until you lose your benefits. Stay vigilant and be prepared by joining the Entitlement Protection Network today. Act now by visiting www.ssahelp.com. That's www.ssahelp.com. See the link below. If you find value in these reports, please smash the subscribe button. Thank you for watching.